9 seconds, and now we can take several thousand images within a few seconds' time.
Hospital emergency rooms, triage centers, urgent care centers, and trauma centers. To become an ER nurse, you will have to get your Bachelor of Science nursing degree and also pass the National Council licensure examination. You will need a minimum of 2 years of emergency nursing experience before you apply to take your certification exam. You can now get certified in emergency, flight, pediatric emergency, and critical care ground transport.
An administrator, a manager, a researcher, or an educator. The average salary is $44,000 to $57,000 a year.
An emergency room nurse must be able to identify which patient needs their attention first based on severity and overall condition. Using medical knowledge, quick thinking, and common sense, the nurse will be able to judge which patient to attend first. If the situation is life-threatening, the best choice would be to get the attention of a doctor.
Getting a person's vital signs is extremely important. This includes blood pressure, pulse rate, respiration, and temperature. The nurse will administer medicine once prescribed by a doctor. This includes setting up and inserting IV lines and handling pills.
In addition to dosing meds, emergency room nurses may help with medical treatments from everything from sore throats to kidney infections. Nurses may also assist with minor medical procedures as a part of the treatment process.
Medical procedures can mean helping stabilize a patient or suturing a wound.
Emergency department nurses are responsible for follow-throughs on the doctor's orders, making sure that the proper medications are given and procedures and tests are complete.
Emergency room nurses are required to keep all patient medical history, contact information, current condition, medications, and treatments while in the hospital.
When a patient's stay is over, they are allowed to leave the ER. The nurses handle the discharge paperwork and answer any questions that the patient or family have. Transportation from the ER, follow-up appointments, and recommendations for aftercare are also all responsibilities of the nurse.
Hi, I'm Will Cristobal, and I'm an emergency room nurse. A typical day in the ER is not really that typical because it's different. Everything's different every day. I mean, granted, you'll see similar scenarios, but each person's different. So you have the non-critical to the extreme critical. I mean, for example, I'll get a guy with a laceration. I will clean it up, and the doctor will stitch it up. Nice. Or someone will come in with abdominal pain. I'll put an IV line in them, get their blood work, start IV fluids, and give them pain medication to get them comfortable. Or a guy will come in with complete cardiac arrest. The whole team is inside the resuscitation room, and we're pumping, we're pushing medications, we're putting IV lines, and shocking the patient, seeing if we'll bring them back to life.
The most obvious, we both said, is like personality-wise, ER nurses are very like disorganized.
Very disorganized, and
Pop out of the seat of your pants.
Yeah, and ICU are definitely OCD.
Just to give you an idea, I even wrote down like video ideas and things that like to plan for this. But like, have you ever seen that picture on the social media, like that it's all the wires and it says like ER nurses and ICU nurses, and the ICU one, it's like everything's straight and organized, and ER it's just like super intently.
Yeah, that's a perfect representation.
For people that don't know, like you're more focused on like the main issue. Someone comes with chest pain, you're focused on chest pain.
Right.
Whereas in the ICU, like you're literally focused on anything. It doesn't matter if you come in with pneumonia, like I'm still concerned about your kidneys and your liver. Like I'm looking at everything every single day,
Right.
tabs and trends and stuff. And you guys are like,
We're like treat what we need to, either get you out or admit you, and like that's how we look at all of our patients. Really, it's like, what can we do to fix you, or what can we do to get you out of here? I mean, because that's what ER is that we either treat you and get you home, or you're going to be admitted to the hospital.
yeah, treat and street.
Treat and street. That's it.
Looking at all the facts, emergency room nursing is not for everyone. You must be willing to be on the go for the entire shift,
The
rarely taking
typical
a break.
ER nurse will be a fast thinker, quick on their feet with both mental and physical problems that challenge
ER
them.
nurses can be somewhat disorganized due to the fact that they need to get done with one patient and move on to the
The
next.
7 key responsibilities for an emergency room nurse were triage, taking vital signs, administering medicine, providing treatment, monitoring patients, charting,
Being
and
an
finally
emergency room
discharge.
nurse is exciting, stressful, demanding, rewarding. You are the first one that the patient meets, so the first impression counts.